Massachusetts General Hospital Frontotemporal Disorders Unit Learning Livecast. More Than Words, Understanding Primary Progressive Aphasia. My name is Katie Brandt. I'm the Director of Caregiver Support Services and Public Relations, and I'm thrilled to be here today with members of our Speech and Language program to provide information for you about one of the conditions that we care for, primary progressive aphasia. The Learning Livecast is an important series that we're starting today because we're committed to providing the highest quality of care while working tirelessly for a cure for the devastating conditions that we care for. Providing information and education is one of the ways that we provide care. We want to empower families with knowledge, and we're excited about this new way to do it. I am here today with our Director of Speech and Language Programs, Megan Quimby, who will begin our session this morning. Megan, welcome.
Thank you, Katie. I'm very excited to be here to talk a little bit about primary progressive aphasia. To begin, I wanted to introduce our speech and language program. It consists of trainees and clinicians in speech-language pathology who specialize in working with the unique population that we work with, primarily primary progressive aphasia, early-onset Alzheimer's disease, and other FTD syndromes. We collaborate with other team members in the FTD unit, including neuropsychologists, neurologists, social workers, and other researchers. To begin, I wanted to introduce what primary progressive aphasia is. You can think of an aphasia as a language disorder that happens after birth. So an aphasia can happen from a stroke, it can happen from a traumatic brain injury, or it can happen from a neurodegenerative disease. So primary progressive aphasia is an aphasia, so in a language disorder that gets worse over time, and it's progressive. And the primary symptom is the aphasia. That's why it's called primary progressive aphasia. Other syndromes we work with have difficulties in communication, but that's not the primary impairment. In this slide is some diagnostic criteria of PPA. This is more for a reference for all of you to learn more about it. There are 3 subtypes of primary progressive aphasia, so it can look very different depending on what subtype your loved one has. So for the first variant of primary progressive aphasia, I'll be talking about the non-fluent or the agrammatic variant. The main impairments with this variant is non-fluent speech, so effortful or halting speech, difficulty with articulation some of the time. Another symptom can be something called agrammatism, so difficulty producing or understanding complex syntax or complex grammar in conversation. The next variant, the semantic variant, is very different. So their speech is fluent and grammatical. However, they have a lot of difficulty finding words. So they might have a vague quality to their speech. So for instance, they may say something like, that thing over there has a lot of stuff on it, because they have difficulty finding those content words that help express themselves. They also might have difficulty with understanding words, so something we called single word comprehension. So if a caregiver or loved one asks the patient, can you pass the keys or the strawberries or something like that, they might say, what are keys? What are strawberries? Because they're having difficulty understanding the meaning of words. Something called surface dyslexia these patients might have. So when they're reading, they may have difficulty recognizing certain words in written material, especially irregular patterned words. And the last subtype is the logopenic subtype. And they have difficulty with word finding as well, just not as much word finding difficulty as the semantic variant. And they have difficulty repeating phrases and sentences because they have difficulty with something called auditory verbal working memory. So difficulty keeping information in their head long enough to repeat back to the clinician what they heard. They also may have difficulty with fluency. Their speech is often fluent, but it can be inconsistent because of word finding difficulty or something called phonemic paraphasias, where the first sound of a word is difficult to say correctly.
So, Megan, you just provided a lot of technical information. And one of the things about the MGH-FTD unit is that we really are experts in frontotemporal disorders, and primary progressive aphasia is one of those. In fact, I think that that was the condition that our program launched to care for in 2007. So what are some of the things that our program is doing to help to spread this information about these very technical aspects of primary progressive aphasia?
Yeah, I think something that's really important to our lab and to me is our training program, because I think it's really important that speech pathologists around the world have a good understanding of these rare diseases and what they look like and how to treat them. So a big importance to us is training the next generation of clinicians to do that.
Yeah, and I know that you go out to a lot of conferences. I was thrilled when we could go together and present at the American Speech and Language Hearing, or Speech Pathology Hearing Association. Am I saying that correctly?
The American Speech Language Hearing Association Convention.
Yeah, so you could tell I'm not a speech pathologist.
No, but it was really great for us to have work together on two different perspectives and teaching clinicians about a variety of disorders that we work with.
Yeah.
It was really special to be able to do that.
And if you think about that speech pathologist or clinician perspective, and a lot of times I bring that family or caregiver perspective. So why do you think it's helpful for families to understand this information? So if I know that my loved one has primary progressive aphasia, why does it matter if they have logopenic or semantic or agrammatic?
Right, well, it's really important that family members are involved because these conditions are progressive, and I think it's really important for caregivers to really understand what's going on and what to expect in the future. And because there are different variants of it, it can look very different. So treatment will be very different depending on what symptoms they have, and it's really personalized to the caregiver and the patient themselves. So.
Yeah. Well, I think that you've queued up beautifully the next parts of our live cast where we'll hear about assessment and treatment. And at the end, also for families to know that we're going to give people more resources to learn more about primary progressive aphasia, but that people can always learn by going to our website, ftd-boston.org. And we really just want to share the information.
Yeah.
So thank you for talking about the primary progressive aphasia and the 3 different variants. That was very helpful.
Of course. Thank you.
You know, I work with a lot of patients and families through my role as the Director of Caregiver Support Services, especially through support group. And what we find is that hearing this information once, twice, 3 times, it takes a while. And so we're trying to offer different educational opportunities. So one opportunity for education is when families come in for clinic or research appointments. Another opportunity is through support group. We're always trying to provide content through those interactions. And a third is through the educational offerings that we have directly through the FTD unit. So this Learning Livecast is a new and exciting way for us to share content. But every year we have an annual education day, typically in the spring, and you can always find out information about that on our website, ftd-boston.org, and also through our email. So now I'm excited to move along our live cast and talk about how we are able to assess and really diagnose whether a patient has primary progressive aphasia. And so I'll be joined by our clinical fellow, Emily Lawyer. Emily, welcome. Thank you for being here for this important part of our presentation this morning.
Thank you, Katie. I'm happy to be here and talk with everybody about PPA.
Yeah, that's great. So I want to let you just go ahead and talk to us about how do we diagnose, how do we assess if someone has PPA?
Sure, absolutely. So as you said, I'm going to talk a little bit about how we as clinicians assess individuals with PPA and also just review the overall diagnostic process. So first, it's really important to note that there are many different care providers that are involved in the diagnostic process. There are many different steps, and we have different professionals involved in each of those steps. So at the FTD unit, we use an interdisciplinary approach. Our team includes physicians, social workers, resource specialists, neuropsychologists, as well as speech-language pathologists. And each member of the team brings their own knowledge base and expertise, all of which are important as we go on and collaborate to do a comprehensive evaluation, make a diagnosis, and then also provide quality care for patients and their families. Because PPA is such a rare and complex condition, there are many different elements when completing an evaluation. And because of this complexity and the number of tests that are typically done, it can take multiple visits for a formal evaluation to be completed and to form that diagnosis. So here I've just listed a few of the common elements of an evaluation. The first is patient history. So patient history is collected through an interview with a clinician. We ask patients and their care partners questions about the patient's past medical history, about family history, so understanding if there's any family members that have had PPA, other forms of dementia or neurological conditions. And then also ask about their current symptoms, when they started, what they are, how they've progressed, and also how they're impacting them and their daily functioning. Next is a neurological exam. So that would be completed by a neurologist. They'd be looking at the symptoms and then also trying to rule out any other conditions that might be the cause of the patient's cognitive and linguistic impairments. Next, we have neuroimaging. So that allows the clinicians and the team to look at the brain itself. So an MRI scan would be done to look at the structure of the brain, and a PET scan could be done to take a look at the functioning of the brain. A neuropsychological evaluation is done with many patients. It would be completed by a neuropsychologist. It includes a variety of paper and pencil tests to look more in detail to a patient's mental functioning, and it does test across a variety of different cognitive domains. So for example, memory or executive functioning. And the results allow the team to determine if a patient's impairments are isolated just to speech and language, or if they've moved beyond that and are impacting other areas of cognition. And the other thing here is the speech and language evaluation, which is completed by a speech-language pathologist. And I'll talk a little bit more about that on the next slide. So because PPA is a neurodegenerative condition that specifically targets language, it's very important and critical that the speech-language pathologists complete a very thorough evaluation of all different areas of language, not only just for the diagnostic process, but also for tracking and monitoring a patient's symptoms as the disease progresses. So as a part of a speech and language evaluation, the SLP will do tests of expressive language, so one's ability to take their thoughts and transform them into speech or writing, and then also receptive language, so one's ability to understand language. Additionally, another important part of this evaluation is doing an interview with the patient and the care partner. And the reason it's really important to include the care partner in addition to the patient is because they can provide very valuable insight that would be different from what the patient may be able to present to us. They may notice things that the patient may not, or provide just very valuable point of view in how they may see that the impairments are impacting the patient's communication on a day-to-day basis. And when we're doing a speech and language evaluation at the FTD unit, at the end of it, we usually complete the Progressive Aphasia Severity Scale, which is the PASS for short. And this is a rating scale that we use to rate the impairment across all the different language domains that are listed below. And it's rated on a 0 to 3 scale, 0 being the least impaired, so normal functioning, and 3 being more severely impaired. And these judgments are made by the clinician using judgment from what we collect during the patient and caregiver interview, from the test results themselves and the patient history. And it's also helpful for us to understand how the patient has progressed over time. And also understand what variant a patient may have. So for example, if someone's presenting with a semantic variant PPA, you may expect that they have a higher number, denoting more severe impairment in something such as single word comprehension, whereas if someone has the non-fluent variant of PPA, they may have a higher number, again, denoting a higher impairment in syntax or grammar and articulation. And at the end of all this evaluation, the SLP will work carefully to make a personalized treatment plan that will yield the best results for the patient and their family.
Wow, Emily. Thank you for that overview about assessment. I think what I'm so struck by is that you're talking about an interdisciplinary team and then also so many different types of testing.
Yeah,
and
absolutely.
so it really shows that you need this comprehensive assessment to understand these challenging conditions.
Absolutely, and because it is such a complex condition, it's really important to gather information from all these different methods so we can understand better the condition and determine if it is primary progressive aphasia.
Yeah, and you know, what's interesting, you mentioned specifically one of the tools that we use, the Progressive Aphasia Severity Scale, the PASS, and that was actually developed by our team, I don't know how many years ago.
I think it was in 2010.
2010,
I think so,
yeah. So what's great about that tool is not only are we using it with our patients and families, but that it has been shared with more than 200 clinics across the world. Yeah, and I think that that's an example of how training is so important to us, just like our director, Megan Quimby, just mentioned. And you have a very unique position here because you're a clinical fellow. So that means that you're still continuing to receive training while being a member of our lab. And so I was just wondering, you know, what is special to you about that experience to have training with us?
Yeah, there's so many different things I could talk about. So it's really nice. I actually started here as a graduate student, and then as I progressed, was able to take on the role of a clinical fellow. And I think one of the things that I've just loved so much is the opportunity to work closely with patients and their families. And as you mentioned, the importance of an interdisciplinary team, I've really enjoyed getting the opportunity to learn from such a compassionate and group of people who are really committed to finding a cure, as you've talked about before, and bringing their own expertise to the table. So I've had the opportunity to learn from so many wonderful people, and I'm really looking forward to doing that as I progress through the rest of my fellowship here.
That's wonderful, Emily. Thank you so much for bringing this important content to our livecast today and for being a part of our team.
Thank you. I appreciate it.
Thank you. You know, one of the things that often happens, so if you're a patient or a family member who's already connected with our clinical research program, you have probably had the experience of coming to clinic and spending multiple hours with us and our team. So I think that Emily's overview of the assessment process and the highlight of the interdisciplinary team really shows why it takes so long. One of the other things that families often express to me is that they wait a while for an appointment, or maybe they've brought their loved one to multiple professionals to try to figure out what exactly is going on. And then they're hoping, oh, now that I have this appointment with an expert team, we're going to walk away today with a diagnosis and we're going to understand what's going on. But truly, because the assessment is done by an interdisciplinary team and involves many different things, such as those paper and pencil tests, imaging, family history, it's really can take time. So I just want to say that from our team to everyone who's listening, we appreciate all of the time that patients and families bring to those clinic appointments, and that we really see you as partners, as the core of the team when we're working on developing diagnosis and assessment. So now we're moving on to one of my favorite parts, which is treatment. So I'm here today with Shaz Henderson, a speech and language pathologist in the MGH FTD unit. Shaz, welcome.
Thank you so much for having me, Katie.
Yeah. So I want to let you just get started and talk to us about
Absolutely.
treatment.
So hello everyone, I'm Shaz Henderson, and today I will be talking to you all about care, support, and treatment of PPA. As my colleagues have alluded to earlier, many clinicians are involved in the diagnosis and care of individuals and families who are living with PPA. In addition to the medical treatment that a neurologist, a psychiatrist, or a primary care physician might provide, there are many life-enriching treatments that may be helpful for managing symptoms and supporting quality of life in PPA. These include, but are not limited to, speech-language pathology, support groups, music therapy, various community events, individual and couples counseling, as well as social work services. In the next couple of slides, I'll be talking about the importance of speech-language therapy, as speech-language pathologists work with many individuals who are diagnosed with PPA to identify strategies to maximize communication abilities and enhance the quality of life throughout the course of the disease. When considering or pursuing speech-language therapy, it is important to work with a speech-language pathologist, SLP for short, who has knowledge of progressive speech and language disorders. And this is because SLPs work in a variety of settings and with multiple populations, so including children and adults, with different etiologies like stroke, traumatic brain injury, as well as developmental learning disorders, autism, and dyslexia, for example, in children. So given this rather wide scope of practice, it's important to find and work with an SLP who has experience working with progressive aphasias like PPA, who understands the diagnosis and the progressive decline in language impairments, and who can help formulate functional goals that are important to the patient and caregivers, as well as provide communication strategies to compensate for the language difficulties that the individuals with PPA may be experiencing. The goal in PPA is to enhance functional communication in order for the individuals with PPA to effectively convey their thoughts, their feelings, their wants and needs and preferences using multiple communication tools which may involve verbal as well as nonverbal. It is important to note that this type of treatment is different from speech-language therapy that is focused in aphasia due to a stroke or a traumatic brain injury, where the SLP might be focused on regaining the patient's lost language function in an impairment-focused restorative treatment. Again, due to the progressive nature of PPA, adaptation of communication strategies might be important during the course of the disease. As an example, an individual who is diagnosed with PPA, who is at the very mild level, who has some word-finding difficulties, might benefit the most from speech-language therapy that focuses on word retrieval strategies. However, in a few years, the same individual might experience other language and cognitive deficits as well, at which point adaptation of communication strategies that are different and more important might need to be in place at this point in time. When you think about frequency, we typically recommend 8 to 10 sessions at a time, and we really encourage our patients and their caregivers to return on an as-needed basis for check-in sessions. We really also encourage our families, our caregivers, and their friends to join the individual with PPA in treatment sessions, because just as much as the individual with PPA is learning to communicate given this newly acquired language impairment, their loved ones are also adapting to different styles and looking for more effective communication strategies to communicate with them. So we can't stress enough the importance of family and caregiver partner involvement in speech-language therapy sessions. Before I get into the details of some specific communication strategies, it is very important to keep in mind that because every individual with PPA is different, so communications may vary from individual to individual. Here are some examples. An example of a compensatory strategy is the use of assistive technology. And this is often referred to as AAC, which stands for Augmentative and Alternative Communication Devices, which can be high-tech or low-tech. An example I've included here is a low-tech device, which is a communication notebook. And as you all can see in the picture that I presented on the slide, it includes many pictures, words, emojis, and personalized sentences. So as you can see, this communication notebook can be personalized to the individual with PPA. Other compensatory strategies include using nonverbal communication, so drawing or using gestures. And another helpful way is to use an area of relative preservation. So for example, if a person's strength is writing, but their weakness is speech, then using writing can compensate for the area of impairment, which is speech. Structured yes or no questions have also been helpful in people, especially who have speech difficulties or word-finding difficulties. Because word finding difficulty is a hallmark feature in 2 out of 3 variants of PPA, as you may have learned today, namely semantic variants and logopenic variants, word retrieval strategies might be very helpful for these individuals. And some examples include the PAL approach, where the individual with PPA is asked to describe the purpose, appearance, and location of a word that they are unable to name. Another similar approach is the semantic feature analysis. And with this approach, again, the individual is asked to name 6 different semantic features for the word that they're having difficulty coming up with. There are also environmental modification strategies. For example, you may provide adequate lighting, optimize face-to-face interactions. This allows the individual to PPA not only try to understand you auditorily, but also be able to look at you to pick up nonverbal signs of communication, such as your use of gestures, your facial expressions, and others. Reducing internal and external distractions are also found to be useful ways to modify the environment to enhance functional communication with your loved ones. Finally, there is also impairment-focused treatment. There is evidence-based research that shows and has proven to be effective when focused naming treatment is done with individuals with PPA. This has been shown to be retained for up to a year and can be generalized to words that have not been trained in treatment as well. Similarly, script training, often referred to as script therapy, has been proven to be beneficial for individuals with non-fluent variant PPA in grammatical and motor speech aspects of their non-fluency. Moving on to support for PPA. Participation in support groups is extremely beneficial for individuals with PPA and their families, and that they're able to realize that there are other people who are experiencing similar problems as them. There are many support groups that exist for FTD, PPA, Alzheimer's disease, and even for stroke aphasias. While the goals for support groups may vary from one support group to another, some examples include enhancing functional communication in patients with PPA, supporting caregiver resilience, and also providing other means of communication enhancement with collaboration with different therapies. At the MGH FTD unit, we periodically run PPA group, and this is a wonderful picture of our team, including Katie, Megan, and a music therapist that worked with us a few years ago, and our wonderful patients and their caregivers. While we receive many valuable feedbacks, I just wanted to highlight on 2 testimonials that are listed here. One patient reported, "If I'm not able to find the word, I sing." Another patient reported that this is a wonderful support group and that I'm able to connect with other individuals who are affected by PPA and connect with their families. There are also ways to get connected with local music groups. I've included here a link to the outpatient neurologic music therapy programs at Spaulding Rehabilitation Hospital. Spaulding Rehabilitation Network was one of the first in the country to establish a full-time neurologic music therapy program. And they also partner in Boston as well as in other states and cities like Portland, Maine. If anyone is interested, feel free to check out this site. Finally, in addition to the many community events that we host here at the MGH FTD unit, there are many events, caregiver meetups, and conferences that occur in different centers, different hospitals, and within your state. So on the next slide, I will provide some valuable resources for you guys to check out. So here are some links to the resources where you can find more information for PPA. The first that is listed here is the Association for Frontotemporal Degeneration, which is an organization that is devoted to improving the quality of life for those who are affected by frontotemporal degeneration and primary progressive aphasia. Another valuable resource is the Alzheimer's Association, which is linked here. You can actually log in and find your local chapters within your state to find out more information about support groups and local community events. Finally, the FTD Disorders Registry, which is an online database that collects information for those affected from frontotemporal dementia, including PPA. To close, we welcome those who are interested in joining our clinical research program. If you or your loved one would like to participate in research or become a part of our clinical program, please do not hesitate to contact us at mghftdunit, spelled UNIT, at mgh.harvard.edu. Thank you, and it was wonderful connecting with you all through this livecast.
Shaz, that was wonderful. What a great summary. If you think about it, as we started with Megan defining what PPA is and the 3 subtypes, and then Emily talked to us about the interdisciplinary team and how we assess the different types. And what I really heard from you when you talked about treatment was that you spoke about how it was personalized. And I just wonder, what has been your experience? What has been powerful about the experience of working with people to create the appropriate treatment plan for them?
Absolutely. I think a simple response to that is I love to see our patients doing what they enjoy the most and what really improves their quality of life.
Yeah, you know, unfortunately, we have had patients and families come to our program after being with other programs that did not have expertise in primary progressive aphasia. And they've reported to us that they've heard, whether it's through speaking with other clinicians or internet research, that there is no treatment for PPA. And I think that it really does give them hope,
Yes.
right?
Yeah.
Yeah.
I think what I really like to highlight today is that in addition to the medical treatment, there are other intervention programs that can really help manage symptoms of PPA and also improve quality of life by encouraging life participation, as well as encouraging families to join in things that the patients really like to do.
I really loved it when you talked about how the treatment focuses on enriching quality of life. And I loved it too how you talked about patients living with PPA. And what I say a lot of times to families is that just because a diagnosis has come into your life doesn't mean that joy has to go out.
Absolutely.
And that's why we want to empower families with knowledge and information, but also to offer opportunities for connection, which you highlighted beautifully.
Thank you.
So, yeah, thank
it was
you.
great being here.
I'll take the clicker, and thank you so much, Shaz. We
Welcome.
appreciate
Thank you
your
so much for having
contribution.
me.
Yeah. So I hope that this overview of primary progressive aphasia, beginning with the definition, talking about the assessment, and then treatment opportunities, gives you a window not only into this rare condition, but also to the way that the MGH FTD unit speech and language program approaches working with each patient and family. And one of the things that we know that is critically important is to work on person-centered care plans. We look at each patient and family as an individual. We know that every patient and family comes with your unique sets of strengths and challenges, and that we hope by spending time with you and learning about your condition that we will better understand how to care for, treat, and one day cure these conditions. We're so appreciative of the time that you have spent with us in this Learning Livecast. And also, I just really want to take a moment to thank the members of our speech and language team who contributed their expertise and their creativity to making this production happen. Megan Quimby, Claire Cordella, Zheng Ali, Shaz Henderson, Emily Lawyer, and Daisy Hochberg. Thank you so much for your time, and thank you for being part of our team. As I mentioned in the beginning of the livecast, our program is committed to providing the highest quality of care while working tirelessly towards a cure for frontotemporal degeneration, primary progressive aphasia, Alzheimer's disease, atypical forms of dementia, and other related disorders. We are thankful for everyone who's a part of our program, and we look forward to continuing to work with you in the future.